The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.
Consider This, a program of issues and information behind today's news.
It beats 100,000 times per day and about 2.5 billion times in a 70-year lifetime. Hi everyone, I'm Kathy Wyatt. Welcome to this week's edition of Consider This. Our topic, the human heart during this American Heart Month. Joining us to talk more about that are Dr. Scott Schirmer. Dr. Schirmer is an interventional cardiologist at UNMC. Jamie George, Communications Director for the American Heart Association. Jenny Petz, who had a heart attack at the age of 32. And Sherry McGovern, Cardiac Rehab Nurse Specialist at the Nebraska Medical Center. Thank you all so much for joining us and welcome to the show. Dr. Schirmer, we're going to kick it off with you. If you could kind of help set the stage for this interview by walking us through a glossary of terms specifically pertaining to the heart.
Sure. Let's explain the language a little bit here. First is myocardial infarction, which is the medical term for heart attack, and it's commonly abbreviated as MI. It refers to a blockage of a coronary artery that results in death of the heart muscle. Angina or angina is from a Latin term literally meaning to choke, and it's the commonly used term for cardiac or coronary chest pain. It's often a smothering feeling in the center of the chest, but can be, unfortunately, very different from that and can occur really anywhere above the waist. Commonly in the left arm and jaw, but that's certainly not limited to that sort of occurrence at all. Coronary arteries, which I referred to earlier, are the specific blood vessels which come off the aorta, the major blood vessel of the body, and supply blood directly to the muscle of the heart. And it's blockages in those arteries which cause angina, and it's complete blockage of those arteries that generally will cause a heart attack. Unstable angina would refer to a blockage in one of those arteries generally having ruptured, and that causes blood clots to form on top of the rupture site, if you will. If it's sort of a partial occlusion and the artery is not totally blocked, it can be a waxing and waning, coming and going, chest pain which gets worse, gets better, generally gets worse though, progressively. And acute coronary syndrome actually refers to unstable angina or certain types of myocardial infarction or heart attack. It's sort of a general term we use for all sort of rapidly progressive coronary syndromes.
And we have 5 more terms that we'd like to walk folks through here.
ST elevation MI is the sort of heart attack that usually results from acute or sudden occlusion of a coronary artery. In other words, a complete and total blockage, which generally happens due to a plaque rupture. STs are a part of an EKG, which get very abnormal in this ST elevation MI, and it's movement of these ST segments that really differentiates this sort of MI and defines a completely different strategy for treatment, one of which is primary PCI. PCI refers to percutaneous coronary intervention, or doing something to a coronary artery via catheters, balloons, and stents. And primary PCI refers to use of this technique in the midst of an ST elevation MI, or to stop the ST elevation MI by opening the blocked coronary artery. Stents are little wire mesh tubes which are placed inside of coronary arteries and act as scaffolding to help hold the artery open. They're mounted on small balloons. The balloon comes back out. The stent actually stays as a permanent part of the arterial wall. Thrombolytic therapy is another form of treatment for ST elevation MI. These are potent clot-busting medications which are given intravenously. In general, when a hospital is capable of primary PCI, it will do that instead of thrombolytic therapy, but either is an acceptable treatment. primary PCI has been proven over the years to be slightly better and therefore preferable. Statins are very potent cholesterol-lowering drugs which not only lower cholesterol, but stabilize and prevent these plaques in the coronary arteries from rupturing, and turns out they're an extremely important part of the entire armamentarium of preventing heart attack and preventing second heart attack, and they should certainly be involved in any discussion of this sort of topic.
Okay. Interventional cardiologist. That is your title. It is what you do. Talk to us a little bit about your day-to-day and why you became involved in what you do.
Well, an interventional cardiologist spends most of the day in the cath lab or catheterization laboratory, and it's sort of halfway between an x-ray suite and an operating room, and we run catheters up major blood vessels and take pictures of coronary arteries, and often if there are blockages, we place stents to relieve those blockages. We often, unfortunately, do quite a bit of work in the middle of the night these days. It's a 24/7 business, because if someone presents to the emergency room with an ST elevation MI, the first call is to the interventional cardiology team, and as soon as we can get there and get the cath lab open, the patient gets to the cath lab, and we are mandated to be there and be ready to go within 30 minutes. And so that's part of the deal. It's a very gratifying part because there's immediate gratification, and it's sort of the drama and the intensity of it that attracted me to it in the first place.
Really? I was going to say that sounds like a never a dull moment kind of job.
That's a fair assessment.
Okay, thank you very much. And Jamie, you're with the American Heart Association, obviously a huge player in all of this. Tell us a little bit about the association and your role there.
Absolutely. Well, as the communications director, my role is to work with our partners at hospitals like Dr. Schirmer and get those life-saving messages out. We know, the more educated people are, the better chance we're going to have at lowering deaths from heart disease. Like Dr. Schirmer was talking about, if people can get that treatment in a certain amount of time, their outcome is going to be dramatically increased. And so that's what we try to do at the Heart Association, and a major role that I have is getting those messages out, educating people, and ultimately contributing to lives saved.
Okay. If you could, and I know it might be a little difficult, but paint a picture for us of someone who is a heart attack waiting to happen. What does that person look like? What are their characteristics, that type of thing?
Yeah, Dr. Schirmer's laughing, and I think it's because a lot of times we'll see someone maybe, eating the cheese dip or something at a restaurant, and we'll think, oh, that's a heart attack waiting to happen, or, it'll be heart attack on a plate. I know I shouldn't be eating this big burger. And I think we all kind of, a picture comes to mind of that person that we think of that is the typical heart attack, and maybe that person is overweight, maybe they're middle-aged, a lot of times we think male, and the truth is that heart disease doesn't discriminate. It doesn't care how old you are. Certainly there are contributing factors, and your risk increases with certain risk factors, but one of our major campaigns in the past 6 years has been the Go Red for Women campaign, and that is basically to create awareness that heart disease isn't only the #1 killer of men, it's also the #1 killer of women in this country aged 20 and over. So that's really significant, and not enough women know that.
Okay, and we have a graphic, so for those folks out there watching, there are 7 questions that we can be asking ourselves to see if maybe we might be a candidate for a heart attack, and we have that now. If you could walk us through that.
Sure. The first question is, do you have high blood pressure or perhaps a family history of high blood pressure? And the family history is one thing that you can't change. We can't change who our parents are, but being aware of that, if there is a family history, is very important. Number 2, are you physically active? That's an easy thing to do that has a major influence on your heart health. Number 3, do you know what your cholesterol levels are? That's something a lot of times we don't think about it. We don't know our numbers, but it's really important, and it's one of those risk factors you can't see, but it's really important. Number 4, do you have a family history of high cholesterol? Again, that family history part is really important. Number 5, do you have diabetes or a family history of diabetes? Number 6, are you overweight? Again, that's kind of that stereotype, you're making your heart work harder if you're overweight. And number 7, what medications are you taking?
And one thing to kind of let people know, if they see something on here that is a red flag, not to panic, but instead to just call your doctor and go in and make sure that things are as good as they can be with you, and if not, to put together a program in partnership with that physician to make sure that you get back on track.
Absolutely.
Jenny, you've been listening to these folks here for the first few minutes, and you yourself fell victim to a heart attack just a year or so ago. Tell us your story.
A little over a year ago, I was laying on my couch late in the evening, feeding my newborn son. He was 8 days old, and I just had a terrible sensation in my throat. I sat up, and my mom was still in town from having the baby in the holidays, and my husband was there, and my husband thought I was having a panic attack, and it got really serious when I sat up, and it traveled down my chest into my shoulders, and they got really heavy, and then my left arm went completely numb. And my mom ran upstairs to get a baby aspirin, and my husband was just watching football, and I stood up and put my boots on. They were on the wrong feet. I knew that, and there was nothing I could do about this at this point. I said, somebody's got to take me to the hospital. I could hardly mutter the words out, and I just hit the floor. And I was dying on my kitchen floor, and my mom put a baby aspirin under my tongue. My husband and my mom worked together to call the ambulance, and I was there but not really there. I remember the EMTs being there saying they couldn't get a pulse, and my mom, I thought she was on top of me, but I couldn't talk, and they worked together, and they got me there. They got the EMT there, and they got me in the ambulance, and by the time I got to the ambulance, I was awake, and I had come to, and the EMT driver was asking if I had really bad acid reflux, and I was furious, and I couldn't breathe. It still felt like somebody was standing on my chest, and when I got to the ER, they thought maybe I had a seizure of some sort, and then they finally did the EKG and things, and they said, oh, this is a heart attack, and immediately they called the heart cath team and got him there, and I believe within 70 minutes they had put 3 stents in. So I have 3 stents in the arteries of my heart, and then I was on my way to recover, but come to find out, I had very high cholesterol, and I didn't know that. Family history of it, but that was just a part of it. One of the arteries was blocked because of plaque buildup. The other 2, where the other stents are, it was a very rare, most likely from having my son. It was a spontaneous dissection. An artery just blew apart, and the walls from that artery blocked 2 other arteries, and that's how it just shut down completely. So.
Oh my goodness, Dr. Shermer, how common is this? 32 years of age, just had a baby.
Well, the Pregnancy Association is relatively common. Spontaneous coronary dissection is as was described well, is a little bit different process than the typical plaque buildup that ruptures and causes a heart attack. And it's very strongly associated with either pre or postpartum situations.
My word.
The other thing that I think is potentially an underappreciated cause is medications or situations that can dramatically raise blood pressure. Even some over-the-counter decongestants. Decongestants that are in antihistamines can be significantly risky, and I think for that reason.
Wow. And Sherry, you are working, with folks like Jenny to kind of bring them obviously back. Here's somebody who had just had a baby, very young, certainly didn't expect anything like this. You see people all the time coming to you to try to get back to where they were.
Right.
Talk to us about your experiences, and in particular, people like Jenny that you may run across.
As she said, people like Jenny are rare. We don't have as many in our program like Jenny. We do see a wide variety of people at our hospital. We help people to safely establish an exercise program, then to maintain that program, to progress through it and maintain it. It's very easy for people to exercise for the 8 weeks that they're with us and then go home and stop what they're doing. We also do a lot of education. The cholesterol, not knowing the cholesterol, teaching people, you've got to know your numbers, be in contact with your physician. Risk factors are huge. We've gone through the risk factors, the weight and exercise, things like that. But teaching people what they need to know to prevent another event from occurring. Education is huge. As Jamie mentioned, if we can't teach what to do different, we're not really fixing the problem. So we teach a lot too for families.
And do they listen?
I think they listen.
Okay.
We have Dr. Schirmer to reinforce what we're teaching, which is great. We have a very good team. But I tell people, you need to talk to your children, your grandchildren. This starts very young. Jenny has young kids. It starts early. You've got to.
Certainly what you do, though, very rewarding.
Definitely.
Or you wouldn't obviously be doing it. So, tell us about what it's like to serve in the capacity that you serve and help people like Jenny and their families get back to where they were at one point.
I have a great job. I do enjoy my job, and it is rewarding. There's people who can hardly walk through the door. They want to come up in a wheelchair or whatnot, and you work with them and get them stronger. And as I said, we do a lot of educating as well, and it just makes them aware of what they need to do. But the exercise gets them stronger. There's people who don't want to come to see us, and they're probably the most rewarding. People who, I don't need rehab. I don't need to come and see you. I know what to do, and are kind of bitter, but then by the end, they love you.
I didn't want to stop.
Yeah.
I did cardio rehab, and I felt very safe there, hooked up, and I was afraid to go and exercise on my own. So it was a very great experience for me. So,
well, tell us about your rehab program specifically.
Well, I was very freaked out right away. Like, how could I have had a heart attack? I'm so unhealthy, and my cholesterol. How did I not know this? And I've always been pretty trim and not really had to worry about working out, so I didn't. But now I know that it's so important for your heart that it's going to be a lifelong thing. And it's sad that it took a heart attack for me to realize that, but I owe a lot of that to cardiac rehab. I had to start out very slow. I mean, I had just had a baby. On top of the heart attack, I had lost some function in my heart. I started walking. Some of the very elderly people that were there were walking around the laps faster and more than me. And I just slowly worked my way up. And by the time I left, I felt confident that I could work out on my own, aside for the anxiety that I'm still dealing with because I just am so scared about it. But yeah, it was a great experience.
Well, and you had the whole, just had a baby factor to
on top
boot.
of that,
so, psychologically, we're talking a lot about physical rehabilitation here, but psychologically there had to be some repair work done as well.
Yeah, that was
to have been
terrible.
separated from an 8-day-old baby at that time and under those circumstances. So I would imagine, Sherry, there's a lot of that to be done as well. Not only physically are we trying to get people back, but mentally,
Right.
and spiritually we're trying to get them back too. So.
And we do a lot to address people's emotions. People kind of forget that there is a big emotional impact of heart disease. Depression is common after a heart event. People don't like to admit it, but it's good for people to know this is common. There's a lot of people like you going through this, and we're here to help. Your doctor is here to help, and to do what you can to support.
Yeah, the same boat mentality never hurts to, again, know that there are people out there. Jamie, we are hearing this word cholesterol, and I would imagine that there are some other pretty easy ways to make sure that we are on track with where we need to be. I think oftentimes folks may not go in for their doctor's appointment because they think, my goodness, when I do that, I have to take a whole half day off work, or it's going to take me all day, or whatever the case may be. What are some of the simple steps that people can be taking right now that aren't going to take the entire day to make sure that they are getting to where they need to be?
Right. Well, and first I'll address that question about, so many of us, and women especially, sorry, Dr. Schirmer, are, we don't make time for our health because, we've got to get the kids to school, and we've got to go grocery shopping, and even we've got to get our husband to the doctor, and we've got to make sure our kids have their checkups. And oftentimes our health is the thing that suffers from that. And I can't tell you how many female heart attack survivors I've talked to that said it was the last thing I thought about until it wouldn't let me, until I had this event, and it was, nothing else was important at that time. Because if you're not taking care of yourself, you can't take care of anyone else. You know, so that's huge. And one of our big messaging platforms is just that those little choices that you make every day can add up to make a big difference. You know, do you take the stairs or do you take the elevator? You know, just the other day I was at the mall food court and they said baked or fried, and I went baked. You know, and it's kind of disappointing because everybody likes that fried taste, but you know, so just those little choices can make a huge difference.
Okay,
So.
very good. And Jenny, how has this changed your life? I mean, you know, talk to us about that. Surely it was a wake-up call, not only to you, but to your entire family.
Oh, I mean, everybody that I have come in contact with, every one of my friends, my family members, everybody went out right away and got their cholesterol checked. That was probably the biggest thing, because people thought, oh, if she could have high cholesterol, then I could have high cholesterol, because I'm not your average heart attack patient. So everybody really started taking their own health seriously, and just myself, eating better, cutting back on red meat, pretty much cutting it out, because I've gotten a little better now. I've relaxed a little bit, but exercising is the biggest thing. You can lower cholesterol. I mean, I'm on a lot of medication, and I probably will be on cholesterol medication for life, but I'm going to do what I can to help, to know that I am at least trying to prevent that along with the medication. So I eat better, and I really exercise regularly now. And
Kind of seems like a silly question, but what would you tell those people out there watching who thinks, not going to happen to me? I'm in pretty good shape myself, thank you very much, and you know, I don't have to worry about that.
Yeah.
What is your advice?
well, I don't want to scare people, because I think it really truly is, and I don't know how rare it is, but I mean, my cardiologist has told me that there aren't enough patients in my situation, you know, young new mothers, to do very many studies to really know exactly what happened to me. And I don't want people thinking that if they have a baby, this is going to happen to them. But I like the prevention thing, like where nobody was believing me that I could possibly be having a heart attack, and that's more so what I want to get out there. Is don't just push it under the rug, because it could happen to anybody. So, you know, it really could happen to anybody. And
Well, you did a very good job earlier of kind of walking through how you were feeling, and I want Dr. Shermer to reiterate what happens when someone is experiencing a heart attack.
Often it's interpreted as heartburn that just won't go away. There's not always a sour taste, but sometimes there actually is. Sometimes there's even associated belching. If someone is exercising regularly, that's a very good way to sort of monitor your own symptoms. And if you don't slow down and lose power and have any sort of exertional chest pressure that goes away when you stop, then it's unlikely that, or less likely that you're on the road to a heart attack. If you do have chest pressure which comes and goes and keeps coming back and keeps coming back, and as was said before, won't let you ignore it, that's certainly something that you need to pay attention to.
Okay. And Jamie, support obviously very critical in any given situation, especially with something like this. Talk to us about the American Heart Association and the programs and services that would be available to people across the state of Nebraska.
Right. Well, one thing that we're really proud of at the American Heart Association are our websites, and they're all, you know, sometimes you go online and you're not sure whether the information you get is accurate, you know, what you have conflicting things. The American Heart Association website has accurate information that is science-based, and so that's something that anyone can use any time of day or night. So definitely use that as a website. I mean, we referenced the new Heart 360 earlier on the show, and that's a tool that we just launched actually earlier this year, and it's really taking off. It's an online health management tool, and people are really enjoying that. They can set goals, and they can put in those numbers, and you know, we kind of all have those little cards in our purse or wallet that have our blood pressure, but to have it on an online source is really excellent. So anyone can access that. The Heart Association has materials. Just give us a call, and we'd love to help you have an awareness event at your church or at a community event. So if you want it, it's probably there.
And Dr. Shermer, you know, obviously we're being helped quite a bit anymore with the world of technology and the advancements that are being made. What do you see, futuristically speaking, in this particular realm?
Well, there are some drug developments that are underway, although I think it's going to be hard to one-up statins and their profoundly protective effects. I think on a societal level, smoking bans have been hugely helpful, and there's very good data that heart attack rates are dropping largely due to smoking bans. First, heart attacks are not as serious as they used to be, partly because patients are getting appropriate medications earlier. I think, though, if there's a downside, I think we're rapidly approaching a situation in which we risk having insurance companies decide which medications patients are on. Often there are cheaper substitutions which aren't as potent, or for one reason or another aren't as good for the patient. So clearly health care is ridiculously expensive, and global access is hugely important. But we need to balance that against non-physicians making patient care choices.
And Jamie, you're nodding quite a bit there, obviously in agreement. Anything
Right,
you
these
add?
are all things that are on, the agenda for the American Heart Association through our advocacy. The smoke-free laws are huge, of course. We can all look forward to Nebraska going smoke-free here in June, so that's a huge step. I mean, and that right there will save more lives than, just that simple step makes a huge difference. So.
Very good. And with anything else, we do have some information. You had alluded to websites earlier, and we do have some websites that we want to share with people, so we'll put those up on the screen. Take a look at those. All right, so www.americanheart.org, www.hearthub.org, and then, of course, www.unmc.org. And we have one more here for the American Heart Association. You can certainly log on to their website at American Heart or call them up in Omaha. It's area code 402-346-0771. Well, on behalf of everybody watching, I want to thank all of you for joining us, and Jenny, to you for sharing your story. We really do appreciate that. And to those of you at home watching, in the spirit of American Heart Month, we'd all like to wish you a very happy Valentine's Day.
Consider This is an issues and information program produced by UNO Television. More information and program archives can be found at untv.unomaha.edu. If you'd like to share your comments about this show, call UNO TV at 402-554-2516 during regular business hours.
The 12th season of Consider This is brought to you in part by From the Top, a national program showcasing the musical talents of young people. From the Top can be heard on KVNO Classical 90.7 each Saturday at 6 p.m.